Hello there mga mommy, let's go for healthy pregnancy. Tamang pagkain ng dapat para malusog kayo ni baby. Remember mga nanay, breastfeeding malaking bagay. Ito'y ipagpatuloy kahit na over 2 years old. Tamang nutrisyon, don't forget, yan ang tamang solusyon. I like it, laking one, oh, 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 yan ang tamang paraan. Tamang nutrisyon, don't forget, yan ang tamang solusyon. I like it, laking one, oh, 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 yan ang tamang paraan. Ang iyong little girl or boy, sustansya'y dapat puno. Susi sa tamang paglaki, go grow grow food na handa mo. First 1,000 days importante, healthy eating para kampante. Paghandaan nutrition ni baby, makinig sa sinasabi. Tamang nutrisyon, yan ang tamang solusyon. I like it, laking one, oh, 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 yan ang tamang paraan. Tamang nutrisyon, yan ang tamang solusyon. I like it, laking one, oh, 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 yan ang tamang paraan. Laking one, oh, 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 yan ang tamang paraan. Hello there mga mommy, let's go for healthy pregnancy. Tamang pagkain ng dapat para malusog kayo ni baby. Remember mga nanay, breastfeeding malaking bagay. Ito'y ipagpatuloy kahit na over 2 years old. Tamang nutrisyon, don't forget, yan ang tamang solusyon. I like it, laking one, oh, 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 yan ang tamang paraan. Tamang nutrisyon, don't forget, yan ang tamang solusyon. I like it, laking one, oh,
Alright, good afternoon to everyone. Isang malusog at masiglang hapon sa lahat. I am Dr. J. Fred Christian or Jim Lopez, Assistant Professor of the Department of Nutrition and Special Assistant to the Dean at the College of Public Health, University of the Philippines, Manila, Senior TROPMED Regional Center for Public Health, Hospital Administration, Environmental and Occupational Health. And we are thrilled to welcome everyone to our department's celebration of Nutrition Month. I'm honored to serve as your Master of Ceremonies for this afternoon. On behalf of my home department, the UPCPH Department of Nutrition, we welcome you warmly to our celebration of Nutrition Month 2021. This afternoon, we will have a panel discussion with a team, Pampublikong Kalusugan at Nutrisyon sa Bagong Normal, Kaakibat sa Pagtutok sa Unang Sanlibong Araw, or Public Health and Nutrition in the New Normal, ensuring action for the first 1,000 days. The objective of this panel discussion are the following: to provide updates on the current status of malnutrition and the implementation of the first 1,000 days framework, to discuss ongoing challenges and lessons learned in the implementation of nutrition programs, especially amid the pandemic, and to present action points for the higher education sector to support ongoing efforts in addressing malnutrition. Now, I would like to also let you know that we are both live on Zoom and on the Department of Nutrition's YouTube channel. For those who can't enter the Zoom room, they may join us through YouTube. And you may now take a picture of this slide with our QR code so that you can send it to your colleagues and have them join us for this afternoon. To begin our program, may I now welcome the Dean and Center Director of the College of Public Health, TROPMED Philippines, Dr. Vicente Y. Belisario Jr. for his opening remarks. Good afternoon, Dean.
Good afternoon. Can you hear me, Jim?
Yes, sir. Yes, sir. Very clear.
Magandang hapon po sa lahat. Of course, my greetings to our friends, Ms. Rowena Velasco Villar, representing Executive Director Dr. Imelda Angeles Agdepa of the Food Nutrition Research Institute, the UST. Kindly send my warm regards to ma'am. Dr. Nian Silvestre, one of the kindest residents when I was rotating in UPPGH. President Kalusugan na mag-ina. Very nice to see you, Doc Mian. Dr. Martin Pareño, very familiar figure, National Program Officer, United Nations Food Program. Dr. Chori Ignacio, Professor, and our Assistant to the Dean for Academic Affairs here in UPCPH. Dr. Jim Lopez, Special Assistant to the Dean of UPCPH, Event Head for this Nutrition Month 2021 celebration. Of course, the Head of the Department of Nutrition, we call him Chair, Professor in Chair, Department of Nutrition, Dr. Nani Bullicer. My greetings to UPCPH faculty, reps and staff, students and alumni of the UPCPH, also designated as TROPMED Philippines. Ladies and gentlemen, a pleasant afternoon to all. My warm welcome to all in this 2021 Nutrition Month celebration of the UPCPH TROPMED Philippines Department of Nutrition with the theme Pampublikong Kalusugan at Nutrisyon sa Bagong Normal, Kaakibat sa Pagtutok sa Unang Sanlibong Araw. In other words, in English, public health and nutrition in the new normal, ensuring action for the first 1,000 days. The theme is aligned with the nationwide celebration of Nutrition Month, which is spearheaded by the National Nutrition Council. With the theme Malnutrisyon, Patuloy na Labanan, First 1,000 Days Tutukan. And of course, UPCPH TROPMED Philippines is aligned with the National Nutrition Council along this line. This refers to the period covering pregnancy and the first 2 years of life, which is also considered the window of opportunity for optimum growth and development by providing adequate nutrition and promoting psychosocial development. Programs that address the first 1,000 days aim to resolve lingering public health concerns that are the same exacerbated by the ongoing coronavirus pandemic, which we all continue to suffer from. Undernutrition, persistent stunting, maternal health, and food insecurity. These concerns highlight the importance of achieving Goals 2 and 3 of the United Nations Sustainable Development Goals to achieve zero hunger and to sustain good health and well-being, respectively. The recently concluded Rapid Nutrition Assessment Survey conducted amid the pandemic by the FNRI-DOST gives us very important insights on why we need to focus on the first 1,000 days. A staggering 62% of households covered by the survey reported that they are moderately or severely food insecure, up to 40% in 2019. No? And that is a dramatic increase. Worse, food insecurity disproportionately affects households with pregnant women and young children, where prevalence of food insecurity has been noted to be 80.8% and 74.7% among surveyed households, respectively. Moreover, maternal health services have been affected, with 15% of mothers not able to access maternal care. These challenges would surely redound to increase in undernutrition and stunting, which was already high even before the pandemic. Bata pa ako, uso na ito eh. Ngayon na hindi na ako masyadong bata, uso pa din po siya. No? With almost one-third of all children aged below 5 who are stunted, one of the highest prevalence rates in the Southeast Asian region. Amid these dismal statistics, we remain hopeful, no? But we need to work together, no, to achieve the common goal. As public health professionals, practitioners, policymakers, we are in the position to facilitate the implementation of public health programs and other interventions that will aid in improving food security. We are joined this afternoon by quite eminent researchers, program implementers, and advocates who work hand in hand in helping address challenges related to the first 1,000 days. And thank you for joining us, spending your precious time with us this Friday afternoon. On behalf of the College of Public Health, TROPMED Philippines community, we are one with the Department of Nutrition and the rest of the public health nutrition sector in targeting undernutrition and improving food security towards future generations of Filipinos who are healthier, taller, and more equipped to contribute to nation building. We look forward to a very fruitful discussion, interaction this afternoon. And I personally look forward to the recommendations which we hope CPH can push forward, no, with the help of everyone concerned. Isang mapagpalang hapon po sa inyong lahat. Over, Jim.
Thank you very much, Dean Belisario, for our very warm welcome. And of course, we would like to welcome all of our attendees who are coming in. So we have already gradual attendance coming in from all of the people that we've invited, both from the nutrition sector as well as those from our alumni, our students, and our partners. So thank you so much. Okay, so before we introduce our speakers, we would like to get to know all of you first. So we have two questions that will be available to our viewers via Zoom. So first poll is, where in the country or world are you in? So we have a few options here. So we would like to know if you're in the Philippines, Southeast Asia, South Asia, Middle East, Europe, Africa, and if you're in the Americas or Oceania. So actually, kinulang na kami ng options for this, right? So there. And what line of work do you do? So we would like to ask if whether you are in the local government, either serving as a nutrition program officer or a barangay nutrition scholar. You're very welcome. Thank you for coming. Kayo talaga ang number one sa puso talaga ng nasa public health nutrition. Mga kasama natin sa national government agencies. If you are from a private sector institution, a non-government organization, international agency, independent professional or consultant or others. So we will give you 2 minutes to respond, and I will launch the poll now. Okay, so feel free to answer this question. Okay, so interesting. We have a lot of people mostly from the Philippines, right? Especially from the NCR and Luzon. We also have a few from Visayas and Mindanao. Thank you so much. Line of work, we have para siyang ano, no? Para siyang karera, gumagano siya. So we have local government, national government. We have a number of people from the private sector, from hospitals and from corporate. We also have people who are from NGOs, civil society, volunteer organizations. We have a few from international agencies and those who are working as professionals or consultants. So we are very happy that you're here. Okay. All right. So just so we will have a streamlined program, no? So we would like to share a snapshot of where we are or where we come from and what kind of work we do within public health nutrition. I'd like to share the results to you. Okay. So it's basically most of you are in the capital, are in the national capital region, but a lot of us are also from Luzon, Visayas, Mindanao. One is from another country in Southeast Asia. So thank you very much. Of course, we are part of the Southeast Asian Ministers of Education Organization, Public Health Network, or CIMEA TROPMED, and we're very happy. We take pride in being part of the network. What line of work do you belong to? So most of our colleagues are from national government agencies, but some of them are also working in local government, in private sector, in civil society. Some of them are also in international agencies or are working as consultants. Okay, so with that, I'd like now to proceed with our next part of our program, which is basically to introduce our distinguished panel of speakers for this afternoon. Now that we have a good idea of our audience, let's now proceed with introducing our first speaker. So I'm very proud to introduce to you our first speaker. Our first speaker is Dr. Martin Pareño. Dr. Martin Pareño is a National Program Officer for Nutrition at the World Food Program Philippines. He is a medical doctor with wide experience in public health, community medicine, and programs addressing nutrition in emergency and development programs. He specializes in the provision of technical support to partner government agencies and civil society, especially those that are involved with the Scaling Up Nutrition Network. Prior to his current affiliation, he worked in the Department of Health, initially as a rural health physician and nutrition officer in Limasawa, Southern Leyte, as part of the Doctors to the Barrios program. He eventually became a supervising health program officer at the Health Emergency Management Service, also at the DOH. He also served as Health and Nutrition Coordinator of Action Against Hunger International in the Philippines. Dr. Pareño holds a medical degree from the West Visayas State University College of Medicine and is currently completing his Masters of Public Health here with us at UPCPH. He's also currently part of the advisory group of the Enhanced Partnership Against Hunger and Poverty, which is a flagship program of the Philippine government. And it's also a member of the Scaling Up Nutrition Core Group in the country. Without further ado, we would now like to welcome Dr. Martin Pareño, who will talk about regional trends and way forward for scaling up nutrition in Manila. Dr. Pareño, you have the floor.
Thank you so much, Jim, for that kind introduction. It seems like this afternoon is a kind of a reunion for all of us, and it's always good to be back in our alma mater and to share with you likewise what I'm doing with the World Food Program Philippines. So as mentioned by Dr. Jim, I'm be presenting to you the regional trends and way forward for scaling up nutrition and new normal. And again, my profound thanks to Dr. Belisario and the rest of the CPH team for inviting me over. So the outline of my presentation would definitely be focused on three areas. The first one is about the indicators of food security and nutrition status in the global platform as well as in the different regions of the world. Second is the trends on the food security and nutrition. And then the third one is the actions to scale up nutrition and new normal. So I'll go first with the different indicators. So for the purpose of this presentation, I'm giving only about 15 minutes to discuss this. I'm gonna talk about the situation for the whole population that is being measured using the following proxy indicators. The first one is the prevalence of undernutrition and the prevalence of food insecure people. The second one is for children 6 months to less than 5 years old. Stunting, wasting, overweight, and obesity. I think some of you already have some background about what these types of malnutritions are. The other one is for children age 0 to less than 6 months, low birth weight, and exclusive breastfeeding. And the other one is an adult, the overweight and obesity, and anemia among the women of reproductive age. Why do I choose these indicators? Because these are the similar indicators that is being measured by the World Health Assembly by 2025, and we only have about 4 years more to go and make some performances on that part. And the other one is on the SDG 2030. So similarly, those are the indicators being measured by the two different independent bodies. All right, so let me start off with the percent or the prevalence of undernourished people per region from 2005 to 2020. As you will notice, this data came from the state of food insecurity and nutrition in the world in 2021. So it's quite very, very recent. When you look at the line graph here, you will see that the one in blue line, that's the data for the world. That's the prevalence of undernourished people in the whole world. And you can see there that from 2005 until 2014, it actually made some changes no, all across. But then beginning 2014 up to 2019, it seems like it's status quo. Not until when we experienced COVID-19, and at the time when everything else went back to the previous situation, the percentage of undernourished people begin to rise again. As you can see there, for the world, we already have about 9% of the people globally who are already malnourished, and this is equivalent to around 720 to 811 million people globally. Then you can see also there the trend for Asia. Around 9% of the people living in Asia are undernourished. And the one for the world data, it gives us an idea that from 2019 up to 2020, the prevalence of people who are undernourished increased by about 118 to 161 million more on top of what is already existing in 2019. But among the different regions in the country, you can see here that Africa is really very, very high at 21% of its population. When you look at the distribution of these undernourished people globally, with an average of 768 million, you can see here that almost half of that are living in Asia. It's very sad. We have about 418 million of them, followed by Africa at around 282 million, and the rest from the Latin American, Caribbean countries, followed by Northern America, and of course, Oceania with only about 3 million people. Now let's look at the other indicator. It's about the food insecure people since 2014 up to 2020. I'm sorry about the heading. It should have been 2014 and corrected. You can see here that about 1/3 of the world's people is suffering from moderate to severe food insecurity. And moderate and food insecurity are highlighted here because these are the ones who are really at the verge of contracting diseases and other forms. The mild form of food insecurity is not being reported in this report. You can see here that those which are in maroon are those suffering from severe food insecurity, and the one in orange are those who are suffering from moderate food insecurity. You can see here that with the world's population of about 7.8 billion in 2020, you can see here that already 30% of them are suffering from moderate and severe food insecurity. From 2019 alone, we already have about 2.05 million people. Plus, because of the pandemic, it increased to 2.37 billion. That's amounting to around 320 million more people suffering food insecurity. Now, with regards to the effect of COVID-19 on the non-affordability of nutritious diet, because one of the reasons why we have this high magnitude and prevalences of malnutrition all over the world is because, of course, of COVID-19. You can see here that prior to COVID-19, we only have about 1.3 billion people who cannot afford nutritious diet. And because of the COVID-19, it escalated to an addition of 17% or around 220 million more people who cannot afford nutritious diet. And there is a study that WFP conducted here in the Philippines way back in 2018. We call it the Field the Nutrient Gap. And there was a huge correlation, a strong correlation between the non-affordability of nutritious diet and stunting. And it's basically very applicable to areas like BARM, Region 4A, Bicol, and areas which are often hit by emergencies. So you can see here that indeed food insecurity is always driven, of course, by socioeconomic instability. You can see here that for South Asia alone, from 592 million, it increased to 719 million. So it has some political, at the same time, socioeconomic implication as well. Are our social safety net programs enough to cover the need of the people, particularly those who have been affected by the COVID-19 or not? Or what are the other things that we need to do in order to ensure that we keep them from becoming malnourished later on because of non-affordability of nutritious diet? Now let's look at the other indicators, particularly for children below 5 years old. We have low birth weight, exclusive breastfeeding in green. We have the stunting, the one in light blue, then wasting in red, then overweight in purple, anemia among the women of reproductive age in pink, and obesity in blue on the far right side. You can see here that the data is coming from the state of the food security and nutrition in the world and the UNICEF WHO World Bank joint malnutrition estimates as of 2021. So it's very, very recent as well. So in 2020, we have around 948 million estimated children aged under 5. And you can see here that in the case of low birth weight, we are still beyond the target of 10.5% in 2025. Please kindly take a look at the first bar on your left side. You can see here that in 2012, the low birth weight globally is 15%. It decreased somehow to 14.6%, but still very far from the 2025 WHA target of 10.5%. The same is true with the 2030 SDG. With regards to the exclusive breastfeeding, still we are very far from the target of reaching at least 50% or increase by 50% from the baseline. Currently, we are at 44%. That's the latest data, right? And then in 2030, it should have increased to 70%. So there's a lot of implications, particularly the infant and young child feeding and supporting the other mothers, particularly those who are affected by emergencies, and often displaced because of some armed conflict and other catastrophes. Now, with regards to stunting, take a look at it. The data that we currently have is 22%, and 22% is already equivalent to 149.2 million children all over the world who are stunted, and based from the WHO standard is already very, very high. In the Philippines, our current stunting rate is about 28.8%, so it's also high. Now, with regards to wasting, that's another type of malnutrition. These are children who are skin and bones. We have about 45.4 million of them, and our current status is at medium. With overweight, we have about 38.9 million children all over the world, and it's also on medium category. But look at anemia. Oh, by the way, just before I proceed to anemia, still, with these three types of malnutrition, we are still far behind the target for 2025 and 2030 as well. Now let's go to the women of reproductive age and anemia. The current data would tell us that there are about 29.9% as of 2019 women of reproductive age who are anemic. It is still very high as compared to the target of 14.3 by 2025 and 2030. And then our obesity among the adults is also increasing in trend and still far behind the target of 11.8%. Now let's go to the next slide. Now this is the very specific information I would like to show you with regards to where are these stunted children in the world. Now take a look at those in purple. Those in purple are countries whose stunting prevalence is more than 30%. It's very, very high. And you can see here that Southeast Asia belongs to that category. And it used to be a problem of African countries. Now it even affected Southeast Asia and as far as the northern part of Asia itself. I think only Australia got a low prevalence of about less than 2.5%, but the rest of the other countries in the world are between either medium or high or very high category, and it's very problematic. The other one is the prevalence of wasting. You can see here that the world is at 6.7%, so it's medium. But when you look at Southeast Asia, the one in circle, it's between medium to high. Look at Philippines. Our wasting, I think, is about 5.8%. I haven't checked the last data, but it's more or less within that category. The rest of the world have prevalence of less than 2.5%. Those are in green. Next is on the category of overweight among under 5 children. The world is at 5.7%. And it's good because the color of the countries in green, including the Philippines, is still below 5%. But I think the trend now is also increasing because of some fast food chains and the food environment that we are having in the Philippines. Now, what are the main drivers on the recent food security and nutrition trends? Why is it that the the magnitude and the prevalence is as high as that? So in the last 10 years, one of the issues actually is that the frequency and intensity of conflict, climate variability, extremes, and other economic downturns have increased significantly, and this was actually aggravated by the COVID-19. And it is also supported by some of our studies, not only in the Philippines, but also in the whole world. There was a rise in hunger that resulted to the non-affordability of nutritious diet and affecting particularly the low and the middle income countries. The other one is most of these countries actually are having different drivers why malnutrition is very, very high. And majority of the undernourished people who are stunted are living in those countries. And the other one is the existence of external and internal drivers. When you say external, it's about conflict like the one in Barm and climate shocks. And Philippines often hit by emergencies, particularly a typhoon at least 20 times in 1 year. And the other one is the non-productivity and inefficient food supply chain, what was actually aggravated by the COVID-19 itself. I think the COVID-19 was a real test for all of us to ensure that we can still continue with achieving food security by maybe planting our own plants in our backyard. And this resulted to high cost of nutritious diet and non-affordability of those types of food. Now, these are the things that I think we need to understand in order for us to scale up nutrition in new normal. The first one is to improve the food system, the social protection, the healthcare system, information technology, and coordination, and implement what we call the scaling up nutrition strategy from 2021 up to 2025. That's already in the third leg, the Sun 3.0. So here, these are the other actions with regards to improving the food system. There was a recently concluded UN Food System Summit in Rome last July 26 and 28, and Philippines was part of that summit. And the main summit will happen in September in New York. So there are some initiatives already that was conducted in the Philippines before this July 26 and 28 pre-summit, led by the Department of Agriculture with Dr. Dar as the convener for the Philippines. And then there's an upcoming Tokyo Nutrition for Growth Summit in December. So what does the UN food system talk about? And what are the action tracks and the action areas that we need to understand in order to scale up for this new normal? The first one is action track number 1, access to safe and nutritious food for all. I know it's not very specific, but it's broad stroke. These are the things that we need to have a look at and invest in. The second one is sustainable consumption. The third one is nature positive production. Fourth one, inclusive livelihood. And the last one is resilience. So in each of these action track, there are action areas which we need to also put our investment in and ensure that it's being done, implemented, and it's being cascaded up to the level of the local government unit. So these are the areas. I will not go into the details. But the outcome of the 2-day pre-summit last July 26 and 28 recognized the 7 outstanding coalitions. And these 7 are: 1, Nutrition and Zero Hunger Coalition; 2nd, school meals; 3rd, food loss and waste; 4th, agroecology and sustainable livestock and agriculture system; the 5th one, aquatic and blue foods; living incomes and decent work; and resiliency. And I would like to use also the statement of Dr. Glenn Gregorio from Sharka, because he was part also of the Food Systems National Dialogue a few weeks back. He said that breastfeeding is the first component of the food system. It's very, very true. So I think it's very important because during emergencies and calamities, there are no other available foods especially if the market is not available or completely destroyed. Now, with the Nutrition for Growth this coming December, that the summit would like to look at integrating nutrition in the universal healthcare, transforming food, and promoting safe, sustainable, and healthy food to support people and planet. And I think this is the area where we need to maybe look at and concentrate ourselves in the transformation of the food. There are food which are available in some parts of the Philippines, but are not available in some other parts of the Philippines and resulted to food waste. And we need someone to help us out in transforming them into more nutritious food that can be consumed by the community at a very low cost. And the other one is looking at resilience to ensure that our access and even the availability of the food is there despite the onslaught of weather and time. And we need to have that kind of resilience. Now there's another strategy that was just newly launched, and Philippines was the first in Southeast Asia to do this. This is a scaling up nutrition strategy for 2021 and 2025. So the meat of this strategy is those promises that was made in Sun Strategy 2.0 will now be put into action, will be implemented, and there will be some sort of improved partnership, particularly with the private sector, to ensure that the promises that we have in the Philippine Plan of Action for Nutrition and the PDP Ambition 2040 are implemented. The other one is investing in social protection. We need to ensure that social protection should be in all fragile contexts. We need to ensure that pregnant lactating women, children, the disabled ones, those who are marginalized are provided with social protection and it's implemented efficiently. The other one is inclusive social protection to leave no one behind. Everyone should be included there. Shock responsive social protection, meaning to say, how can we utilize our existing calamity fund before an emergency happens in order to mitigate the effect of such calamity? The other one is enhancing the food insecurity and nutrition impact on social protection. I think that's a missing part. Say, for example, in the case of our four-piece program, and at the same time, the provision of the a family food pack that is distributed by the Department of Social Welfare and Development, we can still enhance that to ensure that the nutrition and energy need and other social needs of the beneficiaries are being provided. Example, the iron fortified rice should have been implemented as part of the family food pack, but it's not yet being done, mainly because of the problem with supply and demand. And at the same time, the behavior of the people, their acceptability of the iron fortified rice vis-a-vis their previous negative experience in 2010 when the iron fortified rice was distributed, but it all started in the wrong footing. I said that mainly because the type of rice that was distributed was not really good in terms of quality. And the type of fortificant that we used was coating. So it gave a color of yellow to the kernel itself. And then we know that Filipinos, like other Asian countries, we are really fond of eating white rice. And the other one is digital advisory and solution services. And this part, this is where we wanted to understand whether the coverage of social protection programs, like for example, in the case of four-piece program, is really well implemented. Are there double entries? And then are we really providing the necessary requirement or need for those who are in the grassroots or something like that? And to ensure likewise that we link them up to different social services, like now that some of the social services are closed because of the COVID-19 and the threat of the Delta virus. So I think that's all from my end, and the references of my presentation are on your screen. Please feel free to visit this when you have time, and I'm happy to respond to your questions later on. Thank you so much, Dr. Jim. Over to you, please.
Thank you so much, Dr. Martin. And of course, we very much appreciate all the things that were shared a while ago during your talk about, for example, you emphasized about how malnutrition is actually very multifactorial. There's this tendency to think of malnutrition as just the lack of food. But of course, we also have to consider that it's not just the lack of food, but of course, other factors as well that limit the options for a more balanced diet. We also recognize the importance of multi-sectoral engagement, since of course it's not just it's not just the capacity to give food, but to also allow the environment to provide proper nutrition to our most vulnerable sectors of the population. And we also recognize from your talk that multi-sectoral engagement, especially through what you are exemplifying in the World Program, it's not just necessary, it's critical for success. And of course, we also know that social protection will ensure that everyone is included in these programs and no one will be left behind. So thank you so much, Dr. Martin, for your insightful talk. We will now have our second speaker. Okay, so our second speaker is Ms. Rowena Viahar. Ms. Viahar is Science Research Specialist 2 of the Nutrition Intervention Evaluation and Policy Section at the Nutrition Assessment and Monitoring Division of the Food and Nutrition Research Institute, Department of Science and Technology. She specializes in research focusing on nutrition assessment, nutrition intervention, monitoring and evaluation, and policy. She holds a Master of Science degree in Nutrition and Dietetics from the Philippine Women's University in Manila and finished her bachelor's degree in the same discipline at the Polytechnic University of the Philippines, also in Manila. She is also an alumna of the Southeast Asia Nutrition Leadership Program at the Simeo Regional Center for Food and Nutrition, Jakarta, Indonesia. Her recent publications include the following: the process evaluation of nutrition intervention strategy in a local Philippine setting, assessing school lunch feeding and nutrition education strategy for healthier kids in selected Philippine public schools, and the science and technology intervention strategy on complementary feeding to improve the nutritional status of young children in Tuyo-landed disaster areas in the Philippines. So obviously, she really does a lot of research, and we really look forward to listening to her insights this afternoon. So we have with us Ms. Viahar, as she shares with us first 1,000 days, trends, challenges, and action points amid the pandemic. Ms. Viahar, the floor is yours.
Magandang hapon. Isang mapagpalang hapon po sa lahat. At maraming salamat. As mentioned, my topic is on first 1,000 days. Hindi ko lang
Your video, please. Ms. Viahar, thank you. All right. You're
Yes,
Sige po.
sorry.
Thank you.
Okay, muli isang mapagpalang hapon po sa ating lahat. As mentioned, my topic is on first 1,000 days, trends, challenges, and action points amid the pandemic. I will share related survey results conducted by the DUSFNRI before and during the pandemic. Sorry, merong... Nawawala. Sorry for the technical problem.
It's okay po.
It is the mandate of the DOST-FNRI to undertake researches that define the citizenry's nutritional status with reference to the malnutrition problem. Also develop and recommend policy options, strategies, programs, and projects for implementation by appropriate agencies. Diffuse knowledge and technologies in food and nutrition, and provide science and technology services to relevant stakeholders. My presentation will focus on the nutrition situation of the pregnant and lactating and infant and young children, the major physiological stages by which the first 1,000 days revolves, the challenges experienced by the selected households during pandemic, and action points on what we can be done together. The first graph shows the trends in the prevalence of nutritionally at risk pregnant women, where a decreasing trend is observed from 2005 to 2019 but remains high at 21.5%. For anemia among pregnant, there was a slight decrease from 2013 to 2019, however, still considered a health problem. And among lactating women, anemia prevalence is decreasing from 2003 to 2019. This slide shows the prevalence of low birth weight among children. Mapapansin natin, fluctuating ang kanyang trends. There was a slight decrease in the prevalence of low birth weight from 2015 to 2019. Low birth weight essentially tells us that the fetus has undergone distress even in utero. The graph is disaggregated by 2-month age grouping. Dito makikita natin sa graph ang stunting, kung saan ito ay nagaganap sa 0 to 20 months old na mga bata. Unti-unti tumataas mula sa 9 to 10 months old. Ngunit pagdating niya ng 20 months, ang stunting, ito ang pinakang peak ng stunting, the period of nutrition vulnerability. So ang mga sanggol na isinilang na mababa ang timbang ay nagsisimulang magpakita ng senyales ng stunting. Even nasa sinapupunan pa lang siya ng kanyang ina. Dito sa trends in the prevalence of malnutrition among children 0 to 23 months old, although in all forms of malnutrition, the different forms of malnutrition from 2015 rather to 2019, there was a downward trend, but malnutrition in this age group remains a problem, especially the stunting. Makita natin, mataas pa rin siya with 23.7%. So as mentioned kanina, nabanggit ni Dr. Belisario about the Rapid Nutrition Assessment Survey na ginawa po ng DOST-FNRI noong 2020. That was done to get the snapshot on the nutritional experiences encountered by selected households that may affect the health and nutrition of maternal and child. The nutrition-related concerns found during the COVID-19 pandemic were increased food insecurity, lalo na nung buwan ng Abril and Mayo, and mostly affected were those households with pregnant and children. Also, low percentage in seeking health services for children, and in pregnant women seeking maternal services. So in this slide, we can see the low availment of nutrition programs by infants and young children, particularly on growth monitoring, receipt of micronutrient powder, vitamin A supplementation, and deworming. Majority of the respondents, or 69.6%, said that Barangay Health Center was their most accessible health facility during the time of pandemic. During pandemic, breastfeeding practices were not affected. Pero makikita natin, there was a slight increase from 2019 to 2020. However, this increase were not significantly different. Just the same, the data shows that about 40% of the children are not breastfed either exclusively or combined breast and bottle. What are the implications to pregnancy and lactation with these findings? It can lead to poor pregnancy as well as poor pregnancy outcomes, which may result to low birth weight and compromise infant survival rates. Lactation can also be suboptimal with a poor condition of the lactating mothers. When it comes to complementary feeding practices, this is also a concern because it shows that 20.2% of infants and young children are not able to meet the minimum acceptable diet, suggesting that 80% are not meeting their energy and nutrient requirements. With poor quantity and quality of diets among infants and young children, their health and nutrition may soon be compromised. So habang lumalakas sila, pwede sila maging stunted, underweight, and wasted. So with these implications mentioned to infants and young children and to the pregnant and lactating mothers, if left unsolved, may further result to weakening of immune system, increased susceptibility to COVID-19 and other viral infections, which may lead to tremendous high medical costs, lost opportunities, and economic drain in the long term. With this data and challenges, ano po ang pwede natin gawin? Prolonged food insecurity should be addressed to augment the nutritional needs of the pregnant and lactating mothers and the children during this time of pandemic. Campaign more on backyard gardening and other food sources of the community for self-sufficiency and provide employment to increase their buying capacity. The community recognized the importance of barangay health centers. However, this time of pandemic, access to health and nutrition programs was affected. So we need to strategize delivery of health and nutrition services. Increase the visibility of health staff in the community, as well as the supplies of vaccines and supplements. So dahil pandemic, there are areas talaga na takot ang mga taong lumabas and there are restrictions. So house-to-house delivery of services may be an option. Pero dapat sundin pa rin ang strict protocol ng IATF. We have to influence change in the behavior of pregnant and lactating women to improve their diet. Maximize the use of digital or virtual platforms in promoting messages on first 1,000 days. Use simple messages and have easy materials that are laymanized and translated in the local dialect para mas madaling maintindihan at maunawaan. Since the community workers are the frontliners in the barangay, they should be continually trained and equipped on health and nutrition, particularly IYCF. Set up social media and community FB accounts as a way to promote good nutrition using simple messages. So even this time of pandemic, the conduct of researches related to first 1,000 days should still be done to gather evidence-based data na pwedeng magamit sa pagpaplano ng ating mga stakeholders. The DOST FNRI to develop more easy and nutritious food products for women of reproductive age and infants and young children, specifically in times of pandemic and emergencies. Also, to continue its advocacy and promotion in complementary feeding, utilizing the complementary foods developed. This is also part of the first 1,000 days. So let me end with this message. Starts right in the first 1,000 days of a child. Provide optimum maternal and nutrition and proper health care. With this, thank you for listening.
Thank you very much, Ms. Rowena Bihar. And of course, we picked up from your presentation the importance of research. It's something that we really need to consider since paano natin mapapaganda yung ating programs if we don't have any information on how to improve them further. Of course, we also recognize the importance of looking at it from a holistic point of view. Hindi lang bata ang dapat natin tinututukan, kundi ang mga magulang na nagbibigay din ng nutrition sa mga bata. And of course, their health as well. So it's health of mother, child, and the family. So thank you very much, Ms. Rowena. Now, our next speaker is Dr. Maria Asuncion, or we call her Mian, Dr. Mian Silvestre. So Dr. Mian Silvestre is a pediatrician and educator and advocate for maternal and child health and nutrition. She obtained her medical degree from the University of the Philippines in 1982 and her internship at the Philippine General Hospital the following year. After completing a residency in pediatrics and clinical fellowship in neonatal and perinatal medicine in PGH in 1986, she pursued clinical and research fellowships in neonatal and perinatal medicine at the Children's Hospital of Michigan and Hutzel Hospital at the Detroit Medical Center and Wayne State University, Michigan. She then returned to the Philippines and joined the clinical faculty of the University of the Philippines College of Medicine and PGH in 1997, where she eventually served as associate professor and neonatologist. In 2010, she founded a nonprofit, Kalusugan ng Mag-ina Incorporated, or Health of Mother and Child, which has contributed significantly to capacity building efforts for the Philippine integrated management of acute malnutrition, the design of the National Health Financing Special Benefit Package for Severe Acute Malnutrition, and Z Benefit Package for preterm and low birth weight babies. And she did all of these programs in partnership with the Department of Health and UNICEF. With the WHO, she collaborated on the implementation of essential intrapartum and newborn care, or Unang Yakap, a time-bound sequence of evidence-based life-saving interventions in the labor, delivery, and immediate postnatal period. She is currently a member of the Independent Review Group for Early Essential Newborn Care of the WHO Western Pacific Regional Office that reviews country data on EENC's quality improvement efforts in priority countries. Along with her colleagues in KMI and as part of the Alive and Thrive program of global public health consulting firm FHI 360, Dr. Silvestre contributed to the EENC scale-up efforts and establishment of breastfeeding centers of excellence in Myanmar, Cambodia, Laos PDR, and Vietnam. She is a prolific author and researcher and has written numerous research publications in peer-reviewed international journals, book chapters, and technical papers. We will hear from Dr. Mian Silvestre as she now discusses capacity building for maternal and child health, lessons and challenges for higher education. Let us now all welcome Dr. Silvestre.
Maraming salamat, Jim, for that kind introduction. It was only unkind when you started mentioning the years in which I completed that my previous training and my past life. And also, I'm trying to share my screen. And just a second po. So obviously po, obviously my former teammates in the wards are now deans, deans and professors in the College of Medicine or in UP Manila. So, sandali lang po. Can you see my screen po?
Yes.
Okay. All right. Now I need to. Okay. Okay. So magandang hapon. That was my title. But I'm starting off my disclosure actually with this. I'm representing the PhilCan, no? My organization, my NGO, is a member organization of the Philippine Coalition of Advocates of Nutrition Security, which is a convener of the SUN, the Scale Up Nutrition Civil Society Alliance, no? And of course also KMI is a member of the HPAC, the Health Professionals Alliance Against COVID-19. I'm also a faculty member of the Asia Pacific Center for Evidence-Based Healthcare, and those are the two hats that I wish to use right now. So we are a non-profit organization And I won't go through our mission vision anymore. You can see it, and it's obvious from the name of our organization that we really want to focus on not just the child or the mother, but the mother and the child as a dyad. No, as such, I declare no financial conflicts of interest with the manufacturers, distributors, because we're in maternal and child care, distributors of tobacco products, nor with any manufacturers nor distributors of breast milk substitutes, nor baby foods, and any other products covered by the Philippine Milk Code. So on the point of view of intellectual conflicts of interests, I'd like to thank the Department of Nutrition. No, apart from giving me the title of my talk and restricting the duration to 15 minutes, they had absolutely no influence over what I'm about to say. Maraming salamat po. I'd like to start off with a story and faces. This is the story of baby Ruel. I did not put black how do you say this, bands over his eyes anymore, because number one, Real Time is a news show, no, on a major TV network, and he's featured here. What's so shocking about this, the images that came across to us, and I'm acknowledging my KMI colleague, Dr. Donna Capili, no, who helped us secure this footage, no. Sorry, it was downloadable from YouTube, no. But what was so, nakikita po natin yung sinasabing butut balat, no? I should speak in English. The skin and bones that we're talking about in severe wasting or severe acute malnutrition. And the message really drives straight to the heart, because this boy was found by the news team in a supposedly remote barangay in Region 5, no, the Bicol region, and he was 2 years old at the time these photos were taken. So you can see from how his physical appearance and also what he was doing at that time, crawling, no, hindi man lang nakakatayo or nakakaupo ng diretso, pagapang na, no, so very weak. But what I would like to also say is, look at his eyes, no, somehow meron pa rin siyang direct eye-to-eye contact, no, not the apathy that we see usually with the severely wasted children, no. The photos on your right are after Dr. Andrew Buko of UNICEF tracked this child down, no, the toddler down. And Dr. Buko is carrying that child in his arms, already nutritionally rehabilitated, okay? And below, I wanted not to show my own picture, but I wanted also to emphasize this, no? Now, at 3 years of age, when he was already nutritionally rehabilitated, okay, the book that we brought him was the first ever book that he ever handled, no? And you could see the amazement in his eyes. But because we did not catch him at the right time in the crucial window of the first 1,000 days, when his brain should have been rapidly developing and synapsing, this child of 3, okay, was handling the books with a lot of tenderness, so with the very, very loving mother, no? But wala po siyang speech, no? He couldn't say mama. We missed the golden window of opportunity for interventions, no? So we may have caught up on his weight, but on his brain development, we weren't able to reverse anything anymore. Hopefully, we just keep him out of hospitals, etc. Why did I point out his eyes? Was because of this. When we actually got to speak with the mother, she was not a crazy mother. She was not a negligent mother. She was actually breastfeeding her baby up to 2 years of age at the time of the before pictures, no? But what's sad about it was whenever the family had enough money, they would buy formula and of course try to stretch the formula. They had free range, yung native chicken, but they did not cook the chicken, nor give the child the chicken liver or the protein or the chicken as a source or the eggs. Because in her mind, because of all the inconsistent messaging that these families receive over TV and radio. They didn't have social media there, despite the fact that if you look at the floor of this house, they're not utterly poor. Hindi po sila destitute. They had money on occasions to buy other food than what they had, in their backyard, no. But whenever they had money, they bought formula, and diluted the formula to stretch it, thinking that that would be the best food to give to bring this child out of his predicament, no, yung kanyang malnutrition. So
You're on mute, Doc Ian.
I'd like to go to the next slide, which of course is our 1,000 days, no? That interventions for children. We were children. Interventions don't start at the day of birth. They don't start with Unang Yakap. Interventions start at the time of conception, no? And we do have known evidence-based, cost-effective interventions that should improve the health, nutrition, and developmental outcomes of the children up to 2 to 3 years of age. But also the impact of proper infant and young child feeding strategies have long-term impact on the health of both the child and the child's mother. No, so if I chose to borrow this slide from UNICEF because I prefer the formula here. And what do I mean by that? No, it's the 270 days of pregnancy, and the next days until the 1,000th day is framed on the infant and young child feeding strategy. It is not from birth plus 365 days times 2. The framing is the first 6 months of exclusive breastfeeding starting in the first hour of birth with Unang Yakap practices, continuing on exclusively until the child reaches the 6th month, at which time complementary solids with nutritionally, the full nutritional complement, diversity, preferably appropriate and indigenous foods locally available, no, rather than products bought off a shelf, no. So the complementary feeding that started at 6 months, but the message that is oftentimes damaging, that is oftentimes missed, is that breastfeeding should continue. It should continue from 6 months onward. It's not formula that should be started. And if the mother continues to breastfeed successfully up to 2 years of age, if she opts to enter into a contract with her child to extend her breastfeeding beyond 2 years of life, then extended breastfeeding is that relationship, the continuing close nurturing relationship between that child and his or her mother. So yung continued breastfeeding na yan, and also early introduction of solids, for example, or even mixed feeding, all of these examples are examples of what are called suboptimal breastfeeding that the Lancet Nutrition Series now recognizes as already a type of undernutrition. So you start off with a fetal growth restricted baby, no, with fetal growth restriction, type 1 undernutrition, and then you continue on with suboptimal breastfeeding. So this is the wrong slide. Okay, but just to show you that here with this older slide, that the Philippine Plan of Action for Nutrition, yung ating roadmap, no, for what needed to be done starting 2017, the 5-year period till 2022, was formulated earlier than 2017. But after that, there have been landmark national legislations like the UHC law, the Kalusugan at Nutrisyon na Magnanay Act 11148. These are Republic Acts, but arising also from the COVID-19 pandemic and the lockdowns, there are also recent, in 2020, DOH department circulars. Why am I going over these things? It's not only knowing the impact these cost-effective, known technical packages of interventions, but it's also understanding nutrition governance and what we can do outside of the academe, in civil society, etc., in the development sector, and even in the humanitarian sector, what we can do that will impact on enabling all the environments for all these babies and mothers that we want to protect and save. No? For example, in the Universal Healthcare Act, of course, I said this was an old slide because kalakip doon sa UHC Act is primary care, okay? And also how our national health policies can be updated. Hindi ho dapat ma-lock in yung mga health or nutrition practices in laws. No, we should have explicit processes to develop clinical practice guidelines, to introduce new cost-effective health technology through health technology assessments, etc. In the first 1,000-day Act 11148, we have to bear in mind that even in this national piece of legislation, the World Health Assembly Resolution 69.9 is explicitly up for consideration. And what are some of the features of WHA 69.9 is that there is no need for follow-on formula, and it says no to cross-promotion. So the department circulars govern, so this is nutrition governance, even in humanitarian settings or emergency contexts, no, govern and reiterate previous guidelines on nutrition in emergencies, and specifically 0231 guides us with the standardized regulation of donations, no, in emergency contexts related to our Philippine Milk Code. That there should be no general distribution, no solicitation, no acceptance of infant formula, and other artificial milk products that are marketed to replace breast milk, the so-called BMS substitutes. Pati na rin po yung bottles and teats, no, etc., etc. So other than that, as academicians, as members of institutes of higher learning, yung recently Supreme Court ruled, Mandanas-Garcia ruling, which was targeted to address inequity by improving LGU, or the capacity of local government units, no, and enhance transparency and accountability. The programmed increases in internal revenue allocations, or IRAs, are scheduled to be actually received, no, in 2020. This is an old slide, and I got that off the web, a 55% increase. But according to one of my regional colleagues who I communicated with, apparently now it's 37.8% increase in the IRAs. So I'd like to share this governance framework. That's a governance framework for health, but definitely this can be a nutrition governance framework. I borrowed this slide from the Philippine Institute of Developmental Studies that I was fortunate to consult with a few months back. And the framework emphasizes not just the bureaucratic side of governance, no, what should be done in terms of policy, regulation, monitoring, but it emphasizes also the beneficiaries, no, feedback from clients, from patients, from citizens, no. When we assessed the implementation of the Philippine Plan of Action Action for Nutrition, in the gray zone, we see here some of the gaps that we found when we went down to the locus of implementation of the PPAN. The locus of implementation in RA 11148 is supposed to be the barangay, no? But we saw that that awareness, adoption, and accountability were at high levels at regional, provincial, municipal levels. But when it boiled down to the actual front line for nutrition, dyan po nagkakatalo, no? So in the bullets, you see there the skewed resource allocations and distributions, inconsistent and limited funding, the lack of investments in appropriate manpower necessary for implementation of the PPAs or the projects, programs, and activities, and also failure to recognize regulations and manage conflicts of interest. Which brings me to the topic, what are conflicts of interests or COIs, no? And I'd like to point you to a very useful reference that I feel all of us that are working either in academe, training all these nutritionists, doctors, nurses, midwives, policymakers, that are working on implementation research or program implementation, like as NGOs or members of civil society organizations. We should all recognize that this is a predicament that we are in. COIs are defined, they are not fixed, no? COIs are defined as circumstances. They are situations that create a risk that your professional judgments or actions regarding a primary interest will be unduly influenced by a secondary interest. So for example, please allow me to move the participants here. Primary interests include what we do in centers of higher education, no? They include promoting and protecting the integrity of research, no? Protecting the quality of medical education, trabaho po natin yan, and protecting and promoting the welfare of patients. Mga primary interests yon. They are fundamental, they are core to our values, no? But there are secondary interests, no? And these include not only financial interests, but also other interests, like for example, pursuit of individual professional advancement and recognition, no? These are, you cannot take these away, these secondary interests from people. And of course, the desire to do favors for friends, family, students, or colleagues, or friends that suddenly become your friends because you allowed yourself into a circumstance that puts you at a risk of a debt of gratitude, in Tagalog, utang na loob, okay? So, why am I talking about conflicts of interest? Sorry po, ayaw gumalaw. There we go. Okay. Is because before we can manage these conflicts of interests, we have to acknowledge that they are there. No? And how do you manage? I have only enough time to give you a few examples. For example, the management through divesting. Okay. On the left side of your panel, you have the Royal College of Pediatrics and Child Health. That is the professional society of pediatricians in the United Kingdom. And what did they decide in February of 2019 is they stated that they would no longer entangle or they would no longer engage themselves with funding from milk companies. That's the Royal College, United Kingdom. On the right side of your panel, the British Medical Journal, no, in March of the same year, they published their articles that you see on the right side. So these are divestments. They decided, divesting, okay? They decided, no, we're no longer going to accept advertisements from formula companies. And in their article, they reported that they had a long debate among the partners, among the editors of the British Medical Journal, and the refusal of milk company ads would result in as much as 6 digits, 300, close to 400,000 pounds, no, of losses from these advertisements. Canada, very beautiful example of how they managed conflict of interest through disclosure and disengagement. No, in the Canada Food Guide of 2020, so they worked on it as their evidence base. They used the evidence review for dietary guidance in 2015, and also as the evidence base, the food nutrients and health interim update from 2018. But they did not stop there. For using these documents for over 100 food-related topics, no, they retrieved, no, so they searched systematically for high quality they searched systematically for systematic reviews, scientific reports, and they appraised, no, so they acquired the evidence, they appraised the evidence using principles of evidence-based medicine and evidence-based healthcare, and they included in their food guide only high quality systematic reviews, what constitutes what we call best available evidence, no? And what is so landmark about this is they decided explicitly, deliberately, to exclude industry commissioned reports to reduce the potential for or the perception of conflicts of interest, no? So we see here little excerpts from their food guide. They even had considerations from indigenous peoples in Canada, just to show how thorough their stakeholder consultation was. They had at least 3 to 4 pages of these evidence and engagement issues in their process of developing the food guide. And the result of their food guide not only told them what to eat, but they told them also how to develop healthy eating habits for families and communities, no? And it changed the landscape of their plates, no? The pictures of their plates, when they removed industry commissioned research from their evidence base. So, I'm approaching my last 2 or 3 slides. So the question posed to me was, in capacity building for the first 1,000 days, what are the lessons and challenges that confront us today, no, in 2021, a year short of the end of our PPAN, no? I think core to this process of capacity building is what we should be doing now, no? Is going from evidence, well acquired, systematically searched for evidence, critically appraised, digested, managed as to conflicts of interest, and this data should be converted to policy, both for health and nutrition, which should be closely interlinked. And then from policy, what we are faltering with is practice and promotion of the F1K nutrition specific or direct and nutrition sensitive interventions that we know to be so, no? Evidence not only from calorie counts and protein and mineral content, no? But evidence also from the first food system that Dr. Martin alluded to, no? And that Dr. Glenn Gregorio emphasized. Dr. Glenn is the executive director of the Southeast Asian Center for Graduate Studies and Research in Agriculture. No, he is a UN Food Systems 2021 champion, and he emphasized that we seem to be ignoring the first food system for every single human being. No, and what is that food system? It's the breastfeeding mother and child. No. So I looked up this second diagram here that looked into the stakeholders, no, yung sinasabing multi-sectoral partnerships that we're supposed to be building for implementation of the PPAN, no, through the convening function of the National Nutrition Council. But I will say that I don't think the partnership should be framed this way, in that every partner has a say in all of the steps, from evidence to policy to practice and promotion. No? And what I'm particularly concerned with is what is supposed to be considered in RA 11148 is the recent, especially WHA, the World Health Assembly 69.9, which specifically zeroes in on the use of follow-on formula, on cross-promotion, and the support for research and scientific activities, supposedly, of academics, of students, of professionals. No, cross-promotion. We tried as much as possible to insert these how do you say them, rules of war, no, in the implementing rules and regulations of our 11148, no. We even discussed things like the use of formula colors that are traditionally known to the milk companies, no. So these are things that still remain up in the air, no. I recently, though, was really bothered by one of the posters in social media that was brought to my attention, where they didn't use the colors of the dairy companies. What the dairy company did was it stamped its company name onto the colors of the university. No, so talagang find a technical loophole and use it. No, that thread that you can pick at dun sa isang weave, no, at bunutin mo yon, no? So the impact on delivering simple, clear, but also consistent messaging to mothers like that mother in Bicol, no? Hindi natin nagagawa because the partners that are called into these multi-sectoral engagements are delivering consistent messaging, inconsistent messaging that can be very damaging to our mothers. So as a last slide or two, the critical pathway, sabi natin, is evidence to policy to practice and promotion for the first 1,000 days PPAs that we're talking about. Instead of horizontal lines, unidirectional to the right, what it should be is bidirectional arrows, no? So that this, how do you say this, iterative loop of learning that we learn in academia should be translated out into the front line, into the locus of implementation, where we look at implementation research, where we get feedback from our beneficiaries, where we talk to mothers, where we talk to civil society, no? And NGOs, without putting ourselves in the circumstance that allows us conflicts of interest. The secret, I think, is not putting yourself in that position, in that situation that you have to bow to others that might have secondary interests that are alien to your core values. So my proposed pathway and stakeholder roles are a little different, that the other partners should not be necessarily involved in every step of this critical pathway, that they should not contribute heavily unless they follow rigorous methodologies in collation of the evidence, in analyzing and systematizing their conclusions. Unless they do that, no, definitely they should not be involved in policy making if they have a secondary interest in the outcomes, or in pecuniary interest in the business, no? If at all, they should be on the right side, no? They should not be accessing our mothers as liberally as they're accessing them now. Health professionals, EO 51 says, these manufacturers, distributors, and retailers should not be using the health system, but we do know that they are. So, and to help us with strong institutions are our universal health care law, primary health care, our national plans of action for nutrition. So government is there regulating, but always in partnership with the beneficiaries. And who are they? For infant and young child feeding in the first 1,000 days, it's the first food system. And I think I can end. I hope I did not go over my 15 minutes of infamy. Maraming salamat po.
Thank you very much,
Salamat.
Dr. Mian. Thank you so much. So marami kaming natutunan. I'm very grateful for all the lessons that were imparted during your talk. I'd like to probably allude to some of them. So you emphasized the importance of policies, which is basically something that you illustrated in the last few slides, which will enable program implementation. But I think one thing that you also emphasize is the importance of stories, of how we can mobilize people towards believing in this cause that we would like to promote as part of the nutrition sector. You also recognize the importance of accountability, something that would also be something that we will be able to practice if we will be able to really know where we are. And where we are, where we stand for. And I think that's also something that is being emphasized by your advocacy for declaring conflicts of interest, of really divesting ourselves of interests that can compete with our aim of really providing the optimal nutrition for our future generation. So marami pong salamat, Dr. Mian, and it's always a pleasure to listen to you. So I would now like to remind everyone to please send your questions using the chat box on the Zoom window. So we highly encourage you to send it to the meeting room. So everyone na lang po. So I understand since we are a relatively large meeting, so just share it right away to our chat box so that we will be able to relay it to the proper resource person. So that will be for Zoom. But we also have live chat on the YouTube channel. So we have a number of viewers on our YouTube channel. So we say hi to them. Hello. So we have around 30 who are with us there. Of course, that will also be staying in our channel in the long term. So if you want to go back to any of the presentations, you can also access our YouTube channel for that. So I would like to, of course, thank our speakers for their wonderful slides, very well prepared, and of course they come from really good experiences in the field. So we will now proceed to the open forum, which will be moderated by our very own Dr. Maria Socorro E. Ignacio, full professor and assistant to the Dean for Academic Affairs of the College of Public Health. Dr. Maria Socorro Endrina Ignacio is a registered nutritionist dietitian. She obtained her Bachelor of Science in Food and Nutrition degree from the University of Santo Tomas and pursued her Master of Science degree in Nutrition and Doctor of Public Health in Health Promotion and Education at the College of Public Health, UP Manila, TROPMED Philippines. She has over 30 years of experience working with the Department of Health and other international agencies. She has handled various roles such as Nutrition and Promotion Advocacy Officer, Social Marketing Specialist, and Behavior Change Communication Technical Advisor. As Communication Manager for the DOH, she initiated the national campaign that popularized locally produced iodized salt in the country. Together with UNICEF, she worked with the Department of Education to promote the similar goals of iodized salt. Currently, she is now a full professor at our department. So let us now welcome Dr. Chori, while also inviting our speakers to also turn on their video so that they can participate in our open forum. Thank you so much. And Dr. Chori, the floor is yours.
Thank you very much, Dr. Jim, for that kind introduction. And I'd like to thank our resource persons, Dr. Martin Pareño, Ma'am Rowena Viahar, and of course, my idol, Mian, Dr. Mian. We have questions from the chat box gathered by our team. And this can be addressed to all because somehow in your presentation, you talked about interventions. The question was, what could be an innovative interventions that you can think of, that you can share to our audience right now, that will enable us to achieve our goal of reducing stunting and wasting in response to SDG goals that we are trying to contribute to. Can we have the first response from Dr. Martin, then from from Ms. Viahar, and then finally from Dr. Mian? Innovative
Thank you so much.
community interventions.
Yes, thank you so much, Doc Chori, for that question. I would like to respond based from the mandate of the World Food Program because I will definitely refer the rest to Dr. Mian for the other things, particularly when talking about pregnant lactating women and children. That's her forte. Although we work together in some areas like in the CMAM Technical Working Group, the Nutrition and Emergency, and some of these things, no? Bihira lang kami makita ni Doc Mian physically, pero sa mga emails kasama kami ni Doc Mian. But anyhow, Doc Chori, maybe what I can probably do in order to address that question is to look at what are the low-lying fruits that we are having right now in the Philippines, and what has been brought into the table with regards to the development of the National Food Policy by the Zero Hunger Task Force and this interagency and this enhanced partnership against hunger and poverty. The low-lying fruits that we have in the Philippines right now is the non-implementation of one the iron-fortified rice. We do have a law on food fortification way back in 2000, and that was also seconded by another law, the National Feeding Program in 2019, that requires social safety net programs like the Supplementary Feeding Program of the DSWD and the School Feeding Program of the Department of Education to provide iron-fortified rice, and the provision of iron-fortified rice again in the Family Food Pack of the DSWD. So the things that we can probably do in order to innovate that is requiring actually an active involvement of the partners, may it be international partners or local partners or anyone. Like for example, in the case of ensuring that they are tawag dito, they are embracing the utilization of iron fortified rice, because iron is definitely important for stunting prevention apart from zinc, is one, partnering in the area of biofortification. We can make use of the livelihood program and ensure that the small scale farmers will be part of the enhanced partnership against hunger and poverty and buy directly from them. The government will be providing them some um, inputs in the form of agricultural inputs, and link them up also with academic institutions like IRI, Sherka, for the biofortification of the rice. Because we know that we're quite concerned likewise about GMO, di ba? Parang pag sinabi natin GMO, hold muna, sandali tayo. Tingnan natin ngayon, how do we address the stunting in the Philippines and wasting? Wasting is not a very big problem in terms of rehabilitating them. The main problem really is to how to address stunting. Because every time na-expose mo yung bata sa wasting, ayun, in the end, magiging stunted na yung bata. You can feed a child with ready-to-eat food, therapeutic food for severe, and supplementary food for moderate, pero pwede silang bumalik eh. It's because of the behavior also of the parents. So there are innovations like the development of inshu mix down there in locality, which we can actually enhance and have it subject to the standardization of maybe FNRI to look at the nutritional content. There are efforts like itong mga recipes na ginagawa ng mga parents natin sa baba. Kasi even if the Department of Education and DSWD have this 21-day cycle menu, sometimes it's not the ingredients are not available. And pangalawa, hindi siya culturally acceptable kasi they would like to prefer yung mga halal food. Another one is on the area of food transformation. There was a time during the pandemic that there was an overproduction of squash in some areas of Maguindanao, but we are here in Metro Manila, we are having a problem of food insecurity because lockdown tayo, hindi tayo makabili ng mga food na yon. So the area of biofood transformation would mean you can make use of that high valued crops and transform it into chips, and we can adapt also the FNRI technologies. Ginagamit natin yan ngayon eh. We can also help them out in capacity building kasi may mga academic institution na naman din po doon sa baba, no? So those other things. And another one is in the area of social behavioral change. I think this is very, very important because even if we have this resources to transform food, to innovate or something, but if the behavior of the producers and at the same time the consumers is not there, then they will not going to use that new technology. So the social behavioral change communication is very important, but it should start with a formative research. I know it's not easily done kasi medyo mahirap siya eh. It involves some research component kasi may formative research ka, kailangan i-contextualize mo ano yung need nila. Is it only eye-easing material? No, baka hindi. Baka it's in the other form of behavioral changing strategies. Yun ang mga nakikita ko mga issues ngayon. Now, if all of those are being provided, then itong mga law natin, mga low hanging fruits natin ay pwede natin from na ma-address no slowly, if not to scale it up. So yun po Ma'am Chori ang pwede kong ma-share with our audience today. Thank you so much.
Thank you, Dr. Martin. Ma'am Rowena?
Yes po. With regards po sa DOST FNRI, we are promoting the malnutrition reduction program. So ito yung ngayon ang aming sagot para sa to address the first 1,000 days kasi ang focus dito ay ang 6 to 23 months old ng mga bata. And ang maganda dito, it has two components, yung supply and demand, kung saan we are promoting the intervention at the same time, may technology component kung saan mga adopters, doon pwedeng kunin ang supplies ng mga mag-i-implement nitong programa na to. So, yun po.
And that could be accessed in your website?
Yes, ma'am.
All
Yes,
right,
ma'am.
that's good to know.
Meron
Okay
po tayong IFNRI.
Yes.
Yun po pwedeng makita yung mga kung nasaan lugar na yung mga adopters and then kung sino po yung nag-i-implement. So, the people can just visit the IFNRI website ng DOST-FNRI. Thank you.
That's good to know, Ma'am Rowena. Now, Doc Mian.
Innovative, okay.
Community-based.
Very difficult, no? Very difficult.
Yes po.
Our 11148 talaga sinabing barangay talaga.
Mm.
And I think I mentioned it in my talk. We know what are the cost-effective interventions. We know each of the pieces of the pie, our national budget, na-inflate pero kasi nag-utang tayo, di ba? Ano natin gagamitin yung ating investments in at the LGU level with the Mandanas era increasing, with the health financing from at the national level for our programmatic interventions like health promotion, etc., in our individual services provision, which will be financed by PhilHealth, no? So ang katalong ngayon is not what the ingredients of our PAP is going to be, but who we allow to mix all these things happening, no? So ang napapansin din namin, and I work a lot with the mother support groups now, is that the mother is being treated as just a beneficiary of all these
yes,
of all these commodity families, no? And that's where parang yung pagka-clinician ko dati in the ICU and the delivery rooms, no, parang we're missing the point to some respect, no. And I think we should really ride on to the food systems buzzword that's going around now, that really, if you think about it, every human being's first food system is with his mother, no? In fact, the exclusively breastfeeding infant, dagdagan mo ng disaster, kung walang nakikialam sa kanilang dalawa, that child is the most nutritionally secure of anybody in an evacuation center. And why am I emphasizing this? Is because 20 typhoons a year, landslide, garbage slide, everything na lang, lava flow, volcanic eruption, we are not establishing therapeutic alliances, to use a clinical term. We're not engaging the mothers as allies in our care for children, because they should be our allies. Sila yung food system na dapat hindi natin buwagin, no? We should be stopping telling mothers, you can't do that. If you're a COVID suspect, dun ka, hiwalay ka, dun ka sa kabila. Yung baby mo dito sa nursery, saksakan na lang natin ang bote sa bibig. We should not be emphasizing to mothers what they can't do. For the mother who cannot breastfeed, here's the formula, no? Because we are disrupting that first food system that on a micro and a macro level is intact, pero tayo yung malabo magsalita. Bakit sabi nung advertisement, start complementary solids at 4 months, hindi naman yun ang sinabi ng health center natin, no? So inconsistent messaging. We were in a workshop one time in one of the regions, and one of the health workers said very candidly naman, and I really salute her observation, kasi po ang tatanga ng mga magulang. And I felt na she was saying her predicament na ang tatanga nila. Pero I think it's because they're victims of all these inconsistent messaging. It's not that they're tanga, they're so confused. Where do I use my money? Should I be buying this expensive bottle and this formula? Because it has all these nice ingredients, DHA, whatever. No, so I think we really need to go back to the most potent of public health interventions, and that is for child mortality reduction, and that is breastfeeding. Save that mother, save that dyad, save their family budget so that they have enough for complementary solids that are diverse later for primary school and all these other things. But shift the interventions backward into the 1,000 days, and also integrate into the programs also the nurturing care framework dun sa ating sinabing ECCD through the family development sessions. Over po.
Yes. Thank you very much for your responses. And there's a follow-up question to that. There's an agreement that indeed it's a good realization now, as mentioned in this question, that really breastfeeding is the best safeguard for food security.
It also prevents obesity and overweight, the other burden.
Yes, ma'am. Yes, ma'am. Thank you for that info. But the question is, with, ang dami-daming fake news, hindi ba po? And then we talk about, and I agree with you, to have consistency in our messaging in promoting breastfeeding. May tumayo mga community pantries, may mga local initiatives to distribute food commodities. How do we safeguard the contents of those commodities, the food items that are distributed in community pantries, that they're really compliant with EO 51? Kasi walang choice yung pobreng nanay but to just accept kung ano yung nandun sa food packs po nila. So how do we safeguard? I know for a fact na may mga violators ng EO 51 by adding commodities such as milk products, formula in their food packs. Who would like to take that question? Yes, Ma'am Doc Mian.
Okay, so aakuin ko na total na umpisahan ko na.
Yes po.
Yung dun sa isang slide po natin, yung DOH Department Circular 2020-0231 that was triggered by the COVID-19 pandemic. And doon nakasaad talaga na we should not be soliciting and we should not be accepting donations of breast milk substitutes, no? And it's sa totoo lang, it's not really the age of the children kasi that's a loophole that these companies use, no? They say hindi 3 and up naman yan, hindi yan bawal. Correct? Follow-on formula. Hindi yan bawal. Sige, bigay. Pati yung chocolate drink, pati yung ibang nakakarton, no?
Yes, ma'am.
So that particular 0231 says that you cannot solicit, you cannot accept, okay? But what do the LGUs now do when there are infants that are formula fed exclusively? Let's say na orphan sila, okay?
Yes po.
And if truly dinaanan talaga, kasi marami po tayong skilled mother support groups and peer counselors that are there, no? That we are training as much as we can. Marami pang pwedeng hierarchy of feeding needs for infants younger than 6 months and up to 2 years of age, no? Nandyan yung mother's own milk, i-express niya, etc. Nandyan din yung wet nursing kapag emergencies, nandyan yung relactation, nandyan yung pasteurized donor milk from our 28 or 29 milk banks all across the country. Tsaka pa lang, last resort ang formula. Pero ang nangyayari is ginagawang first resort ang formula.
Ayun nga po. Yes,
and
po.
what happens is that mother might cherish that solitary tin of formula. If stretch niya ng gusto, ang kauwian niya is malnutrition. It's difficult now because they are locked down in their home. So hindi mo pwedeng gamitin na argument na madumi ang tubig, na wala kang panghugas ng bote, etc. So iba ang messaging dito sa pandemic because they're not in evacuation centers, they're not buried in mud, etc. So what was my point again? Okay, what do you do with exclusively formula-fed babies? It is the LGU now has to purchase. So yun yung 0231. And how did they do that? They should have already made a census of infants and young children that need either preferably breast or formula. So you're not ignoring the formula when you say, oh, pregnant and lactating women, nilagay dito. No. Because the child of the formula mother is even more at risk of dying kasi nag-formula siya. So that mother and that child are also very vulnerable. So dapat talaga suyuin din sila, ali kayo dito sa mother-friendly space. There are ways, meron tayong mga protocols sa nutrition and emergency. Basically, that empower women to tell her that you are enough, but you have to be protected, no? Hindi sila dapat pumipila, hindi sila dapat binibigyan ng formula na nasa bote, no? Parang sabihin. So no infant formula in general distribution, but the LGU has to do individual feeding assessments. Okay, exclusively breastfeeding, dito po tayo, we'll feed you, wag ho kayong For the formula ones, meron ding specialized technique to try to get them to be breast milk fed pa rin, kahit non-orphan na separate, etc. Formula is last resort, and if you really need to do so, buy it. LGU has to buy it. That way, they will learn that they should be pre-positioned in breastfeeding, not just when there's a disaster. Dapat under normal context, mataas na mga breastfeeding rates nila. Para the sisterhood of mothers there already have their therapeutic alliances with their infants, and you don't have to constantly be doling out commodities for them.
Yeah. Thank you very much, Doktora. And meron pang isang tanong dito. Well, that's I guess our health workers really have to be oriented. And I'm touched by your presentation of Rowell. Doktora, we're also working in a project on PMAM. And we're doing a survey, and PMAM trained health workers are nawawala because they are now retired. Some have shifted. So the question is, how do we, and with this pandemic, OPT is not regularly done. How do we identify more Rowells so that we can refer them to OTC and ITC with health workers, with trained health workers who can address their needs? And of course, I'd like to ask question to Dr. Martin to support the question of Dr. Mian. What do we do with the commodities? Are you doing something to supply commodities for ITC, OTC? Dr. Mian first and then Martin.
Okay. Dun sa ating PMAM, merong mas may mas simple, no po, kasi hindi naman nila kayang bitbitin yung Salter tsaka yung height scale dun sa COVID pandemic or whatever disaster.
Ang problema na wala na po sila, nag-retire na.
Kailangan
natin ng online training package, Doktora.
Sabi nga natin, we have to be agile. We have to be quick on the move. We have to figure out what to do, no? So actually, they're piloting a simplified OTC, Doc Martin, di ba, yung screening, using the mothers to measure the MUAC.
Yes. Family MUAC. Yes po.
Yes, family MUAC. So, hindi ka na kailangan magbit-bit ng napakadami. So, screen them with the MUAC, all usual suspects, and then get them in. And that's where you weigh them and do your Z-scores, etc.
Yes,
so, simplified implementations of the program, no? Kailangan pragmatic tayo, di ba? Wais tayo, agile, no? Hindi pwedeng laboratory, very rigorous
rigid
methodologies. Try to work with what they have there. So the MUAC, the family MUAC, home visits instead of visits to the health center. And that's why yung capacitation, yung incentivization, professionalization of our community volunteers like BNSs, PHWs. Over to you, Doc Martin.
Thank you so much, Doc Mian. Yeah, we were both together in the technical working group for the PMAM with Doc Mian as well. And actually, one of the things which I'm looking at, Doc Mian, I don't know if there's already an online training for PMAM because we already did for the nutrition and emergencies, right? And then it's good, Dr. Chori, that you mentioned about the problem of this fast turnover
Yes
of
po.
health workers, di ba? Kasi
Mm-mm,
karamihan sa
mm-mm.
kanila, next year election na naman, baka mabago na naman
Mm-mm.
yung mga tao doon. So, Doc Mian, baka that's something that we need to discuss also with the UH and NNC, no? Online training.
Yes.
And then, yes, Doc, go ahead.
Oh, di ba what we always stress is that, nako, endless yan budgeting for commodities if we don't strengthen our IYCF practices. No? So
Yes po.
IYCF talaga ang core. And I do know that they've piloted the online IYCF program for our community volunteers and our health workers to hopefully expedite this process of retraining and reaccreditation, etc. And then kasunod na dapat, Doc, ang online for PNAM, for
Right.
PNAM. But I
Yes
did
po.
also suggest na sana mag-update tayo ng CPG on the PNAM. There are new things now, like do you really do routine antibiotics for all of them, no? Pwede bang twice a week, ay alternate weeks na lang ang visit kaysa ano, no? Why is the default rate so high, no? Bakit hindi nako-comply? So there's a lot of implementation research that's really fertile for the taking.
Right.
Thank you.
And then during that, to answer to that likewise, there's already a simplified protocol for special circumstances in the use of one product only for both SAM or severe acute malnutrition and
And
MAM.
ma'am, yeah.
Opo. So, gagawa natin yan. I don't know, Doc Mian, kung nagawa na yan ni Ma'am Luz sa Department of Health ng memo. And then another one, Doc Chori, is the World Food Program just came up with this MAM recipe that is intended only for the moderate acute malnourished children, because we have a problem with the supply chain of these commodities, particularly during the height of pandemic. Nagkaroon ng problema sa availability of ready-to-use therapeutic and supplementary food. So based also from the trainings we have had in the past, nagsabi sila, why would we come up with local recipes na pwedeng gamitin? And then just the reason why we work with the University of the Philippines in Los Baños and FNRI to come up with those recipes, and it's already available. I can also share that later on, the link to that, and they can use that actually in their localities, no, to feed babies who are children, I mean, who are suffering from moderate acute malnutrition. So the formulation is more or less the same with the consistency of the ready-to-use supplementary food. It doesn't have
That's nice.
sugar. Even the salt is not there, because we know that the physiology of a child with wasting is deranged already. Now, coming back to your question, Dr. Chori, with regards to how do we address the problem of commodity
Yes
supply
po.
chain issue. So, I don't know if some of you know this, that in 2012, WFP partnered with FNRI in the development of the complementary food called MUMSI. It
Yeah.
has 6 micronutrients, but the real intention supposedly would have been for the development of local counterpart of the ready-to-use supplementary food. But during the time, I think only 5 micronutrients were assessed, no, as a problem in the Philippines. So nagiging MUMSI na lang siya. And then later on, because of the high prevalence of stunting in the Philippines, I requested the technology adapter of FNRI to maybe reformulate the MUMSI and make it comparable to what we call the LNSSQ. So that we call it now MUMSI Plus. And I think it has already gone through the process, and nag-apply na din po siya ng FDA approval. So I think that will be available soon. That would address the problem of supply chain, because the cost of such is very expensive if we're going to buy it from outside. So if available na siya in the country, that would be good.
Yes.
Another one is yung sinasabi ko kanina din na product transformation and having this food hub in specific strategic locations in the Philippines, kasi pag may emergencies, nakakat yung supply chain natin. If we can make use of that and link up with the Department of Science and Technology to support them along the way in transforming available products, like yung even cassava, we can fortify the cassava and make use that as the chips para sa school feeding program, and also creates livelihood opportunities and women empowerment.
Okay, thank you very much for the sharing. One last question, 1 minute to answer, Ma'am Rowena. Can the template or the sample digital or virtual platform for nutrition counseling for pregnant and lactating mothers to promote IYCF can be downloaded from your website so that the health workers can readily make use of it? Libre ba yun? Available na ba yun? Because sinasabi natin consistent messaging. All the more that we can make use of existing IEC materials or for online communication. Meron na po ba sa FNRI?
Sa ngayon, yung part ng yung nabanggit ko kanina, yung sa MRP, yung
Yes
sa
po.
intervention part, sa intervention side niya. Meron siyang mga modules, mga simple messages.
Okay.
Kasama doon ang breastfeeding, complementary feeding.
Yes, that's good.
Ginagamit na po ito ng mga barangay nutrition scholars natin. And base sa mga feedback nila, nagustuhan po nila yung mga materials kasi madali siyang maintindihan at
I see. That's
yun
good.
po ang kanilang ginagamit sa kanilang nutrition education sa mga nanay.
Can that be accessed by the audience who come from the private sector?
Yes.
Okay, that's good.
Yeah.
That's good to know. I guess my time is up. Doc Jim, sorry kasi mga gusto ko yung kausap ko. I can go on and on, but I'd like to thank you for answering the questions from our chat box and from the questions that were supplied by our team. Thank you very much. Over to you, Doc Jim.
Thank you so much, Dr. Chori, and we're very grateful for all the inputs that were given by our resource persons and, of course, for our audience as well. So, of course, I'd like to just ask you to stay on with your cameras since we will have our closing thoughts, our synthesis. So, to synthesize our fruitful and meaningful discussion this afternoon, I'd like to probably ask our speakers to share their closing thoughts and takeaways on their presentations. So we will do so in the order of presentation. So we will first have Dr. Pareño. What would you like our audience to take away from your presentation this afternoon?
Thank you so much, Dr. Jim. Maybe just one-liner, perhaps. I always say this, that the journey to good health and adequate nutrition for our children is not that easy or straightforward. But one thing is certain for sure, we must stay on the course and remain steady and be sure about it. Yeah. So it's very impactful for me as well. So whenever I do advocacy, I always mention to this na sige lang, continue lang. Sabi nga ng Nike, just do it, di ba? Yun ang sabi niya. Sabi naman ng BDO, we will find ways for that. So thank you so much.
Yeah, thank you so much. Of course, I think wala tayong corporate sponsorship for this afternoon, but basically yes, I will agree with that. Thank you so much, Dr. Pareño. I'd like to invite Ms. Viahar. Any closing thoughts?
Sa problema ng kinakaharap pa rin hanggang ngayon sa first 1,000 days, pagtulungan, kakayanin naman to hand in hand, pagtulungan ng mga from the top hanggang sa baba, especially sa mga community, kasi andun sa kanila sila talaga yung nangangailangan ng tulong, ng mga simple interventions and messages na kanilang i-impart sa kanilang mga nasasakupang mga nanay. And for sure, first 1,000 days, kakayanin natin to. Basta tulong-tulong tayo.
Thank you so much, Ms. Rowena. I fully agree the importance of research and yung dapat sinasama natin sa research yung talagang mga nasa mga sektor ng lipunan na talagang nahihirapang maka-access ng ating health and nutrition services. So marami pong salamat, Ms. Viahar. And of course, Dr. Silvestre, I'd like to ask you, do you have any takeaway points for our audience this afternoon?
Okay, nanakawin ko yung minutes ni Martin tsaka ni Ma'am. Ako kasi, sinulat ko dahil I tend to talk too much. Kaya ito po, in my short talk on lessons and challenges for higher education, I spoke as a former academic who moved from the delivery rooms and ICU to the development sector, working mostly under normal circumstances, but in some contingent circumstances in the humanitarian sector too, I attempted to talk about the elephant in the room, okay? That enormous creature that is there, but which makes people uncomfortable to varying degrees, no? Ranging from people who are so immersed in that culture that they are like fish who cannot see water, no? To people who are ostracized by their peers because of their outspoken views. And because people have different vantage points and circumstances, they are like the proverbial blind men who can only interpret what is within their reach. I look forward to further empowerment of women as mothers, grandmothers, spouses, sisters, aunts, supported by fathers, families, and villages, where they truly are the first food system. And we should protect that first food system as passionately as we protect our agricultural lands, our seas, and our rainforests. We pray that the perspectives of civil society be seen and our voices be amplified. And we call on our partners in higher education especially, let us hold ourselves accountable to standards and targets that are higher than what is allowable and minimum. Maraming salamat.
Maraming salamat, Doc Mian. And I also take from that point that it's not just the mother and the child, but also the male caregiver that is being given importance in your message. So of course, we all have our respective parts in really contributing to the improvement of the first 1,000 days of our future generation. So marami pong salamat, Doc Mian. And of course, maraming salamat, Dr. Martin and Ms. Rowena, for being with us this afternoon. So before we really close our gathering for this afternoon, I'd like to award you virtually our certificates of appreciation. So I'd like to probably just read it briefly. So College of Public Health, University of the Philippines, Manila, CMEA TROPMED Regional Center for Public Health, Hospital Administration, Environmental and Occupational Health awards the certificate of appreciation to Dr. Martin Pareño, Ms. Rowena Viahar, and Dr. Mian Silvestre for generally giving their time and expertise as resource speakers in Pampublikong Kalusugan at Nutrisyon sa Bagong Normal, Kaakibat sa Pagtutok sa Unang Sanlibong Araw, given this 30th day of July 2021 at the College of Public Health, University of the Philippines, Manila, TROPMED Philippines. Signed, yours truly as Assistant Professor and Activity Coordinator, Dr. Hernani Arbulyeser, Professor and Chair, and Dr. Vicente Y. Belisario Jr., Dean, UP College of Public Health and Center Director, TROPMED Philippines. Marami pong salamat and congratulations. Thank you so much. So before we bring this webinar to a close, may I now invite Dr. Hernani Arbulyeser, Professor and Chair of the Department of Nutrition, to give his closing remarks. Dr. Hernani, you have the floor.
So thank you, Dr. Jim. So once again, good afternoon, and we are happy to have you with us in this culminating activity of this year's Nutrition Month celebration. So as we are beset with food security and nutrition challenges in the past 10 years, there are multiple drivers that continuously affect food security and nutrition, namely conflicts, climate variability, and economic slowdown. Such was the focus of Dr. Martin Pareño's talk. Dr. Pareño highlighted that this is even exacerbated by the effect of the COVID-19, which contributed to the rise in hunger and has undermined progress that have been made in reducing all forms of malnutrition. As we now move on to the new normal, there are several action points that needs to be scaled up in terms of nutrition, which the Philippines need to put forward and prioritize. So one of the nutrition programs that needs to be addressed, especially during this pandemic, is the first 1,000 days program. Such was the centerpiece of the talk of Ms. Rowena Viahar, which succinctly discussed the Nutrition Month theme for this year's celebration. She discussed several nutrition-related concerns during the pandemic, which resulted to increased food insecurity and low percentage of health-seeking services for children and pregnant mothers due to several disruptions. And she even posed significant questions as to what should be done to address these problems. And finally, for sustainability, there is a need to capacitate LGUs in the first 1,000 days program. Dr. Mian Silvestre reiterated that this should not be the sole role of the LGU, but they should also collaborate with the academe, NGO, industry in what she called as the academe industry government interconnectivity. A word of caution, though, is to observe transparency and accountability. Once again, thank you to our dear speakers for celebrating with us on this year's Nutrition Month celebration. Thanks as well to all those who attended this event via Zoom and those who tune in our live stream in YouTube. I would also like to congratulate the organizing committee of this panel discussion, especially the faculty and staff of the Department of Nutrition, and to Dr. Jim Lopez for leading this activity. We hope to see you in our future trainings and endeavors. Keep well and have a safe weekend. Over to you, Dr. Jim.
Thank you so much, Dr. Nani. And thank you all for coming to the Nutrition Month 2021 celebration of the Department of Nutrition, UP College of Public Health, TROPMED Philippines. Of course, the theme is Pampublikong Kalusugan at Nutrisyon sa Bagong Normal, Kaakibat sa Pagtutok sa Unang Sanlibong Araw. Now, we would like to probably just give you a few words of we would like to promote basically what we can offer as a department. So for more details on our department's upcoming events, we would like to invite you to visit our department's Facebook page. So you can access us by typing nutrition.cph.upm on your Facebook search setting, right? So facebook.com/nutritioncph.upm. We would like to take this opportunity as well to invite you to our upcoming short courses. So we have the online basic course on nutritional epidemiology, which will be held on the 11th up to the 13th of August 2021, and the online training course on the assessment of nutritional status to be held on the 20th up to the 22nd of October 2021. So for more details, please feel free to take a picture of this slide. Yeah, take a picture of it now. Right. And we invite you to scan the QR code so that you can pre-register and join us in these two very exciting events. Okay. All right. So I hope that you were able to take a picture of that. Okay. So those will have a very modest fee to defray expenses for holding the webinars. But basically, we would like to encourage you to join because those will have CPD points, especially for those who are about to renew their licenses, especially for those in nutrition and dietetics and those in other health professions. You can also get updated on the other events and course offerings of our other departments in the UP College of Public Health. So through our webpage, cph.upm.edu.ph, you also have our Facebook, Twitter, and Instagram, UPCPH. Please let us know what you think of this event. Kindly answer the webinar evaluation link. Okay, so maraming naghahanap nito. So ito na yon. Okay, so the webinar evaluation link at the link provided on the screen, chat box, and the comment section for your Zoom and YouTube. Certificates of attendance will be sent upon completion of this form. The form will be available until the 1st of August 2021. All right, so I hope you can just take time to take a picture of this, and you can get back to this later. Okay, so thank you very much for coming to our Nutrition Month 2021 celebration. And once again, I'm Dr. Jim Lopez. It has been a pleasure serving you as Master of Ceremonies for this celebration. Happy Nutrition Month, everyone, and stay safe. So we will play again the 1,000 days jingle, and you can, while doing that, you can do the evaluation for.
Hello there, mga mommy. Let's go for healthy pregnancy. Tamang pagkain ang dapat para malusog kayo ni baby. Remember, mga nanay, breastfeeding malaking bagay. Ito'y ipagpatuloy kahit na over 2 years old. Tamang nutrisyon, siya'y dapat puno.